Hi, I'm Gabby, and I'll be speaking about the effects of the endocrine disruptor bisphenol A. Endocrine disruptors affect the hormones by blocking hormone action or mimicking them. BPA is an organic synthetic compound that is used in many products such as water bottles, baby bottles, storage containers, and food packaging. BPA has been found in urine, saliva, blood, breast milk, amniotic fluid, fetal cord blood, and the placenta. Clinical and preclinical research has shown that BPA exposure is linked to many diseases and could have epigenetic effects affecting future generations. Some diseases that can arise and have been linked to BPA exposure include reproductive disorders, cardiovascular disease, obesity, and breast and prostate cancer. BPA exposure during pregnancy has shown an association with multiple health outcomes such as in obesity, immune function impairments, hormone balance disruption, and neurodevelopmental problems in the offspring. And Haynes obtains urine samples from the U.S. population and tests for BPA levels. There is a total of 344 deaths of adults who participated in 2003-2008, which followed until December 2015. The study found that BPA exposure was significantly and positively associated with all-cause mortality in adults. Biomonitoring studies in the U.S. demonstrate BPA exposure present in 93% of urine samples. Based on the structure of BPA, it is metabolized quickly in the body, which indicates a high frequency of BPA exposure within the U.S. population. The main ways humans are exposed to BPA is through diet when it migrates from food and water containers. Migration occurs at higher rates when the container is washed or heated, and it can occur through other avenues such as dust, air, water, and dental sealants. EPA estimated BPA is released into the environment over 1 million pounds worldwide per year. Although everyone can be exposed to BPA, certain groups are at higher risk, such as those of low income, ethnic minorities, infants, and children. Studies have shown higher BPA levels in the urine of children between the ages of 6 to 11 when compared to adults. One study found that premature babies in intensive care units had higher BPA levels in their urine than what was observed in other infants or older children. And Haynes data showed that those with higher BPA levels in the urine tended to be younger, black, male, of lower education income, and poorer dietary quality. In children aged 6 to 11, those with food insecurity had about 54% higher BPA levels than children who did not have food insecurity. EPA launched a BPA action plan in 2010, and the FDA amended the regulations twice, in 2012 and then in 2013, to no longer use BPA-based polycarbonate resins in baby bottles and sippy cups and BPA-based epoxy resins as coatings for infant formula packaging. Some states within the U.S. have also banned or restricted the use of BPA in products such as in California, Minnesota, Connecticut, and Vermont, among others. One way to reduce exposure would be to use containers that are BPA-free. Other ways include not microwaving food or placing hot foods or liquids in plastic containers and limiting canned and packaged foods. If unavoidable, though, rinsing can help lower BPA concentration levels. Overall, lessening one's exposure to BPA can help reduce any potential adverse effects. And these are my references. Thank you.